what happened was I was completely lost, like everybody is at this particular stage ki karna kya hai.
Welcome to MediStudyCo. Today with us we have Dr. Anahita Deo, who's my senior, and let her introduce herself. Hello, ma'am.
Hi Palak, nice to be here. First of all, hi everyone. Okay, so to introduce myself, my name is Dr. Anahita Deo. I am a BDS graduate from Manipal College of Dental Sciences, Bangalore, and the reason why I'm here today is because I have switched from the clinical sector to the non-clinical sector. And post that, I graduated in 2019, and post that, I was really not interested in the clinical sector, so I decided to graduate. Apart from that, I have this small business, as you might call it, Odigio. So the idea of Odigio, or basically the Odigio, is derived from the word Odigia, which is a Greek word, which means to guide. So the whole purpose of founding Odigio was so that people in the sense healthcare professionals specifically, started off with dentists. Now we are expanding. We have expanded. I have expanded, and I have one more intern with me. So we have expanded to every different sector that's out there, and our specialization still remains in making people switch from clinical to the non-clinical sector. So yeah, that's what the company is about. And this started in May 2021, and it was just an idea. I didn't know what I was doing, to be very honest, but now I can say that after placing 29 clients, I also have a placement in Australia. So after placing 29 clients, most of them dentists in non-clinical roles, I have a good idea as to how this is going and how I can help you out.
That's so nice to hear, and I'm so glad we are going to do this now, because as I'm an intern and I've only been exposed to the clinical part of dentistry, and non-clinical aspects are not even spoken about. So that's the reason we are doing this entire thing. I hope everybody enjoys this and you gain something out of this entire session. So to begin with, I am an intern, and as I said, I don't know anything about non-clinical. So how am I supposed to judge if non-clinical is the thing for me?
Okay, so first thing is that you will not be able to know it overnight, because even I wasn't able to. Like I said, I graduated in October 2019. Post that, I was preparing for NEET because pata nahi tha kya karna hai. Okay. But the main reason why I decided that, I'll just tell you about my experience first, and then how you can, get an idea. I wanted to get into the army, in the Army Dental Corps, but that didn't pan out because my rank wasn't that good. Like it was 4,000 something, but it wasn't that good to get an army seat. So I prepared for that. Then in January 2020, I started working at a clinic. So post that, at that point, like you asked me, I had no idea. Although in internship, I knew that this is not something clinical. The sitting at a clinic and working in one place is not something that I wanted to do, specifically that's why I wanted to get into the army. So what happened was I was completely lost, like everybody is at this particular stage ki karna kya hai, and there was not a lot of guidance around it. So one thing that someone recommended me, so I would recommend to interns, especially interns, because you are at that stage ki ab kya karna hai. So what you need to do is basically analyzing your strengths, your weaknesses, your opportunities, and your threats. Threats here is not something, I'm not saying ki kuch daravna hai, but threats in the sense your obstacles, whatever obstacles you might have. So sit down with yourself, do this, understand what, and when I talk about your strengths, see, you have to understand that you have a certain, everybody has some soft skills. Soft skills is basically something related to your EQ, emotional quotient. So what you have to understand is, are you good at communicating? Are you good at, let's say, writing stuff? I'm not saying that you will know exactly what you have to write, but I'm just saying you like writing, something on those lines. So identify your strengths, then go ahead and identify your weaknesses. For instance, I cannot do research. That is something I cannot do, like write research articles and all of that. So that was one of my weaknesses where I decided I will never go. Then comes opportunities. Now, what you need to understand here is, initially आपके पास opportunities नहीं होगा, so you can just leave that blank for a span of time, but take up as many opportunities, whether it's clinical or non-clinical. Take it up to understand what all is out there. Because see, at the end of the day, when you join college, when I joined college, I was 17. When I graduated, I was 22. And then they asked me to choose कि चलो भैया choose कर लो अगले 30 साल क्या करना है. But that is something which I do not recommend. Ki you have all the time in the world, which is something we as Indians don't understand. Okay? So that is why I'm saying pick up every opportunity, whether clinical or non-clinical, and then identify the obstacles. Now, these obstacles can be personal, professional, that maybe you don't want to spend a lot. Maybe you want to be financially independent. Obstacles, this is not exactly an obstacle, but some challenges that you might face. So do that. And this is your basic SWOT analysis that you should do, and then go ahead and figure out and yeah, not go ahead and figure out. This is not something which will happen overnight. कि आपने कल SWOT analysis किया और आपको परसों पता है that you want to get into the non-clinical sector. I would recommend that grab on as many non-clinical opportunities as you can. If you are really interested to just explore कि क्या क्या होता है, you want to explore that. So grab on to as many opportunities as you can. Do as clinics में भी काम करो. Even I worked at a clinic. Then yes, the pandemic hit, but I was working at a clinic to understand how it is. Because at the end of the day, you have spent 5 years doing this, and 5 years is not a small time, right? So yeah, that is something that I would recommend. Do a SWOT analysis first. Second, give it some time. Think about it, think over it, and internship is the correct time to do this. That's what I would recommend.
Perfect. So, like, I don't know what non-clinical is. What is the kind of job that I'm expected to do, and what are the various options that are actually available for, I mean, in the branch of non-clinical?
Okay, so see, I cannot possibly tell you that how many options are out there, because there are multiple options. But I myself have a list of 30 non-clinical options with me, based on my research, based on where my clients are placed, based on when I was looking for a job, what all I figured out. So what I can do is I can present my screen.
Right.
And I can show you guys what are the different options that are out there, the 30 options that I'm talking about. Okay. This is one thing that I want everyone to know is this is a very broad classification that I've done over here. It's not कि यही है और इन्हीं categories में आते हैं, but I've tried to simplify it as much as I can. So one thing that I want you to understand is, as a doctor, you can do anything in the non-clinical sector as long as it's related to healthcare, because that was my main motive, that I knew कि मुझे clinical नहीं करना, but I didn't want to switch from healthcare because I had built my foundation in that for 5 years. So that was something that I already had an edge on. So the company only had to teach me how the company works and other things, etc. For example, so now there are a lot of management roles that you can get to. You can get into marketing or sales roles. You can get into consulting roles. There are research roles. There are roles in the pharmacovigilance, not pharmacovigilance, but pharma sector. And then you can get into scribing if that is something that you like. So if I broadly classify it, then there are, I think, 6. And then yes, you can get into clear aligners are one of those things where no matter what, any of these roles, you can apply for those roles as a dental graduate, be it a BDS or an MDS graduate. Okay, so another thing which I would like to point out here is that you do not need, and I repeat that, you do not need an additional degree for any of these courses. Although it is preferred, by courses, I mean any of these roles, although it is preferred that you should have a degree for a better package. But if say you just want to figure out ki kya karna, you can get in this right with your base of dentistry itself and medicine itself. You don't need to do any additional, because that is one of the most commonly asked questions too. One of the most commonly asked. So because we think ki maybe we won't be able to, but I recommend कि first पहले थोड़ा काम करके देखो and then understand what all avenues are out there. Because एक चीज ये है कि for example, if you graduated, there are 100 students that are graduating from every college, and you go ahead and do an MBA just because everybody else is doing an MBA who's doing a non-clinical thing, wahan pe to there are 500 graduates. So when you find it difficult to find a job with 100 graduates, imagine how difficult it's going to be for 500. Right? So what you need to do here is you can apply to any of these roles. Most of my clients are working as medical advisors. They are working in the digital marketing space. I am myself a digital marketer. Then they have been working in clinical data management, clinical research associate. They have been working as clinical research associates. Basically, the world is your oyster. If you get into any of these, you can get into any of these roles with your healthcare background. That's the main idea. And if you would like to take a screenshot of it, please go ahead and take one. Okay.
That's so nice. This is so well organized. Like I can try out so many options. I wanted to understand what are the skills that I might require to learn, because I am not exposed to things like marketing and everything in my BDS career. So how is it that I can develop these skills? What are some platforms that I can probably use? Or is it, something like you work and then you already you learn it with your work?
Okay. So again, I'll just start with my example because that's easier to tell you. But when I started out, I was relatively good at Word, Excel, etc. So if I talk about, so there are two types of skills. One is your soft skill, one is your hard skill. Hard skill is something which you have to learn. मतलब मैं बहुत simply बता रही हूँ एकदम कि उसका technical definition मुझे भी नहीं पता. But I'm telling you very simply that जब there are two types of skills कि आपके soft skills हो गए, which I told you about the EQ, and then there are your hard skills which you attain by practice. For example, as a dentist, your hard skill is performing restorations. As a dentist, your soft skill is communication skills, because that is something which is extremely important in any role, right? So now, one thing that you have to note is that as a doctor, you are taught everything. Like, for example, आपके पास ये भी skill है कि how do you have to sell a particular procedure, because I don't have to explain it to anybody, but you know how hard it is to convince a patient, right? So you already have sales experience. You manage the clinic कि एरोटर कहाँ है, उसको स्टेरिलाइजेशन में कहाँ देना है, पेशेंट को कहाँ बिठाना है, उसका रिकॉर्ड वर्क करना है. That is something you already have. So these are the skills that are pre-existing. You already have this because of a very rigorous 5-year course. Now what you can do is, if you want to upgrade your skills, let's say you want to upgrade a couple of your hard skills, so you can just go ahead and upgrade, maybe learn Microsoft Excel, because it's going to be evergreen. Everybody is using Microsoft Excel. बहुत और softwares भी हैं, but let me tell you something, once you get into the company, they will train you. You will get training. So that is something you do not have to worry about. This is something which I tell my clients also, because I got trained on the job. I am teaching people, I'm training people on the job. Then all companies train people on the job. So that is not something you have to worry about. Apart from that, if you want to go ahead with any, let's say, for example, you even remotely think कि ठीक है मैं marketing कर सकती हूँ, ठीक है, I would recommend, there are a lot of Google certifications which are free of cost. It's called Google Digital Garage, ठीक है. You go to Google Baba, there are all the answers that you can get, ठीक है. So Google is one place where you can do multiple courses, and they are so simple and easy कि आपको, you will have no idea about it, but once you start doing the course and by the end of it, you'll almost be a master. Okay, so that is one place that you can get into. Apart from that, building on your soft skills is something which I would recommend. Go ahead and get into as many extracurricular activities, as many research projects, and do volunteering. I'm not saying कि तीनों चीजें साथ में करो, but figure out कि आपको किस चीज में interest बैठता है, ठीक है, and then do those things. Just say, for example, if you ask any professor in college, I was into every extracurricular activity that was out there. I am not a research person. I have never done a single research in my life. One time in Malaysia on observership, I was made to present a poster. That's it. Okay, so I've never done that. But these things definitely help along the way. If you don't even want to do extracurricular, nahi karna, volunteer at a shelter. Dishai, let's say for example, Dishai le lo. ठीक है. And I think you guys are associated with Robin Hood Army
Yes.
also, है ना?
Yes.
And VSO, all of these things, like you can get into that. So these are something that I would definitely recommend, not only to build your profile, but to add on your resume. It adds a lot.
Definitely. I mean, we've seen you there everywhere, and like we really look up to you.